You know, technology is completely reshaping healthcare. It's promising this incredible future of medicine that's personalized, super efficient, and even proactive. But underneath all that exciting innovation, there's this really deep tension. It's a fundamental conflict that every single new health app, every cloud service, every wearable device has to grapple with. So, let's break it down.
Here's our game plan for this explainer. First, we're going to define that core conflict I just mentioned. Then, we'll dive into three huge tech solutions: the cloud, mobile tech, and the rise of virtual hospitals. After that, we'll tackle the one major risk that connects them all. And finally, we'll map out a clear path forward. Ready? Let's go!
So what is this central problem really? Well, at its heart, it's a constant tug of war. On one side, you have the goal of providing the absolute best care for every single patient. On the other, you have the need to run an efficient, financially stable operation. And those two things don't always pull in the same direction.
There's actually a name for this: the patient service dilemma. Every single decision, especially when it's about bringing in new tech, is basically an attempt to solve this puzzle. How do you innovate to make patients healthier without, breaking the bank or completely overwhelming your staff? That's the million-dollar question every single hospital and clinic is trying to answer.
And this dilemma, it creates some seriously big hurdles. We're talking about costs that just keep going up, with budgets that are stretched thin. Think about the doctors and nurses who have practically zero time to learn a complicated new piece of software, or the fact that there just aren't enough skilled IT folks to run these complex systems. And the real kicker? Trying to get some shiny new app to talk to a system that was built 20 years ago. It can be a total nightmare.
So, with all those challenges, where do you even begin? Well, the first major solution a lot of organizations are grabbing onto is the cloud. The idea is pretty simple, actually. Why not offload all the massive headaches of managing data and servers to companies that do nothing but that?
And you can see why it's so appealing, right? Instead of shelling out a ton of cash for huge, expensive servers up front, you just pay for what you use. As you grow, your service grows with you. You get way better performance, your team can access information from anywhere, and you're protected from things like fires or floods. It directly tackles a bunch of those hurdles we just talked about.
And this isn't just some theory. It is a massive, massive trend. Just look at the numbers. The healthcare cloud market more than doubled in just 5 years. It jumped from under $4 billion in 2015 to nearly $10 billion by 2020. That is a huge vote of confidence.
But, of course, there's always a catch. Moving to the cloud isn't a magic wand. It brings its own set of problems. For one, you can get locked in with a single company, which makes it super hard and expensive to ever switch. And because all your data is in one big centralized place, it can become a much bigger, juicier target for cyber attacks. Things like a denial of service attack, which could just flood the system and completely shut down access to critical patient records.
Okay, now for our second big solution. This one often builds right on top of the cloud. We're talking about the tech that's probably on your wrist or in your pocket right now: mobile and wearable health devices.
And this is about so much more than just convenience. What we're seeing here is a fundamental shift in how we even think about care. We're moving away from a reactive model, waiting for someone to get sick and then treating them, to a proactive one, where we can use real-time data to help stop an illness before it ever gets a foothold.
Here's how to think about it. A heart attack itself, that's what we call a lagging indicator. The data, the event, comes after the problem has already happened. By then, it's a full-blown emergency. But the data from your watch, your heart rate, your blood oxygen levels, those are leading indicators. They can flag a problem before it becomes a crisis, giving you and your doctor time to actually do something about it. That is a complete game changer.
So, what happens when you take the power of the cloud and combine it with all this data from our wearables? Well, you get our third major innovation. Welcome to the virtual hospital, an idea powered by telemedicine.
Telemedicine is so powerful because it's a win-win-win. For patients, it means better access to top specialists without having to travel for hours. For doctors and nurses, it means they can collaborate with experts from literally anywhere in the world. And for hospitals, it leads to happier patients, which can actually translate into more funding from the government. Everybody benefits.
And this, right here, might be its most important impact. Telemedicine is a huge tool for health equity. Just imagine you live in a really remote or rural area where seeing a specialist is next to impossible. Telemedicine can be that lifeline, bringing expert care right into your home, no matter where you live.
So we have the cloud, we have mobile tech, and we have telemedicine. 3 incredible game-changing tools, but they all run on one thing: data. And that creates one giant shared vulnerability.
the security of our most personal, most private health information. This quote is chilling, and it shows exactly why data security isn't just some IT problem, it's a clinical problem. If patients are scared their data isn't safe, they might not tell their doctor everything. And this study found that more than 1 in 10 people have done exactly that. When a doctor is working with incomplete information, that can lead to bad diagnoses and worse outcomes. In healthcare, trust is literally everything. So, at the end of the day, investing in top-notch data security is about way more than just avoiding some fines. It's about building that critical trust with your patients. A secure system is also a more efficient system, and as we saw, it can even lead to a better bottom line. It's not just an expense, it's a foundational investment.
Okay, we've defined the big problem, we've looked at the cool new tools, and we understand the massive risks. So, what do we actually do? How do we move forward? Let's lay out a smart, practical strategy for putting these technologies to work safely and effectively.
The path forward really boils down to 4 key steps. First up, vet your vendors like your life depends on it. Ask the really tough questions about security. Second, always have a backup plan. What happens if your cloud provider goes down? Patient care can't just stop. Third, train your people. Most data breaches aren't these sophisticated hacks. They're caused by simple human error. And finally, get everyone involved. Doctors, nurses, admins, IT, everyone, before you make a big decision. A policy that sounds great in an office could be a total disaster on the hospital floor.
And that brings us right back to our central question, to the very heart of that patient service dilemma. All of this amazing technology is creating mountains of data, giving us this incredible power to be more efficient, more predictive than ever. But as we get better and better at using that power, the biggest challenge is to never, ever lose sight of the person behind all that data. How do we make sure that a system driven by data always remains a system driven by the patient? That's the real path we all need to navigate together.